Hi, everyone. Welcome to the Concussion Discussions series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI, and today I am here with Dr. Aaron MacArthur from Portland Chiropractic Neurology, and we're going to be talking all about hyperbaric oxygen therapy. So welcome to the series.
Thank you for having me. It's great to be here.
Yeah, and I don't believe this is a topic we've ever covered before, so I'm really excited. There's a lot of chatter out there about HBOT, and there's a lot of questions out there about HBOT. So
Yeah.
I'm excited to kind of jump into that today. So maybe a good place to start would just be what is hyperbaric oxygen therapy, or HBOT?
Right. And that's what most people don't know. And it is, it's like
What is it?
it's this
How
thing
does it
we've
work?
heard of. I know. Well, hyperbaric oxygen therapy is a tremendous treatment, but how it really works is it works by the mechanisms of the pressure. So you're in a chamber and we apply a pressurized environment. And it's similar to diving in that sense, where you may feel some pressure, but it's not uncomfortable, those types of things. But what's happening during this pressure is that physiological changes are occurring in your body, and this pressure is causing oxygen to be driven into the fluid or the plasma of your blood at an accelerated and tremendous rate. And why that's important is because not only to get more oxygen into our bloodstream, right? We think oxygen. We think of, well, that's good. We know it heals. We know it's important. We know it's important with brain injury, or most of us do. But how do we get more of this oxygen in there? So if we say, well, how do we normally carry oxygen to our brain? Through the blood, but via red blood cells. And red blood cells have a limitation where we only have so many of them, right? So most of us are at a pretty good carrying capacity, it's called, for carrying oxygen, maximally on our red blood cells. And regardless of, whether our circulation is good or not, or these types of things, we kind of oftentimes pretty maxed out by what we can carry on these red blood cells. You can't fit any more in the pack, essentially. But what hyperbaric oxygen therapy does is really interesting, as it takes oxygen and diffuses it directly into the plasma. So it does not require red blood cells to carry it anymore. And so now oxygen is freely floating in your plasma at a concentrated rate, anywhere from, a few percent increase to 1,200% based upon the level of the chamber we're using. And when this happens, you create what's called a diffusion gradient in your bloodstream with this oxygen concentration. We love to go in our body, different things love to go from higher concentration to lower concentration. So essentially what happens is this oxygen is pushed further into your tissues, into your brain, into your heart, into your liver, into your joints, ligaments, all these different things. And you get more oxygen into this system. And why this is important is because oxygen allows you to make energy. Because without oxygen, you can't make energy. And now when these neurons or brain cells get oxygen, they create more energy, they regenerate and heal themselves. And then when they regenerate and heal and they get very healthy, they have all this extra energy still left over. They start connecting with their neighbors and they start creating new neural connections and synapses, they're called. And that's what's called neuroplasticity. So we start to correct errors in the brain, and we start to create faster signaling and synapses so that our system functions at a better rate, or a normal rate, and we can control things that we need to control. We can tell our eyes to move to this target. We can coordinate our hand. We can create better digestion. We can create better thought. We can remember where our keys are. We can remember the name of that actor. We can drive blood flow to where we need to drive it to, all these different things. And that's the nature of hyperbaric oxygen therapy. But that's just the first thing it does, which is really cool. There are other things that happen as well. And I won't go too much in it, because really the first thing that I really want you to understand is that it drives oxygen. And that's the way it really creates the most impact. But we're learning more about it, and it's really cool. It also has tremendous impact on inflammation. So it decreases inflammation tremendously, especially neuroinflammation and all these different things that occur after, long-term chronic, post-concussive issues with brain injuries and concussions. So it not only does it reduce acute inflammation by constricting blood vessels and reducing leakage in those vessels and inflammation in that sense, but it also down-regulates cytokines and inflammatory mediators in our system that occur as kind of a chronic nature, especially after like TBI and brain injury, and can happen after stroke and these types of things. So we really want to down-regulate those types of things so that we don't have this chronic inflammation, which gets in the way of healing as we understand it, without getting further into that. What it also does is it increases, as you can imagine, increased pressure in our actual blood vessels, like what we call microvascular pressure. And so what happens with this is that it actually pushes blood flow deeper. So not only are the oxygen molecules getting deeper into our system, but they're being pushed further into it so they can get deeper into these think about them like those dark areas that you never go into of the forest or something, that never kind of get that sunlight, and they need it and they want to heal. And so it's getting to these areas that are difficult to access through conventional methods, even with some of the neurological rehab that we do as functional neurologists. That is tremendous, that we can get deeper in there. And I actually use I use a lot of analogies. One of the ones I like is like sending trillions of little plumbers in there and healing the leaky pipes. And that's what they do. And they just get in there deep and say, hey guys, go to town. And they create all this energy, and because of that oxygen, and then these areas heal, because the brain wants to heal. It just needs some substrate. It needs some currency to heal. It needs oxygen. It needs glucose, which we get just from eating, and it needs activation. It needs the proper activation through a lot of the things that we do with neuroplasticity work and functional neurologists through the Carrick Institute. But it doesn't necessarily need that always. It can just take the energy and do it itself. And so it doesn't, it's doing it without us, which is really cool. And then some other things it does is as you're working that pressure, that microvascular pressure, it's also strengthening your blood vessels and strengthening this autonomic nervous system. And so you're getting better elasticity and constriction and tone in your blood vessels so that you can pump blood to your head faster. You see a lot of people with concussions and brain injury, which is a brain injury, who have brain fog. And they get dizzy a lot. They get dizzy when they stand up too fast, or lightheaded, not as much the vertigo, but more the disorientation type stuff. And so when you have these things, you need to access this or improve this autonomic nervous system. And that autonomic nervous system is controlled in the brain, but it's also controlled at the levels of the receptors in the blood vessels. So the hyperbaric system, through changing pressure, increasing and decreasing, it activates this system. It actually is like a workout for our blood vessels. And then when you activate those receptors of the blood vessels, it's also increasing the brain activity in the areas that control this. And you're healing those areas of the brain through all this oxygen too. So it's kind of getting this top down and bottom up mechanism, and you're hitting it from all angles. It also releases stem cells. Research shows that it releases stem cells at an exponential rate, which is imperative for healing in these different aspects. And helps with detoxification and lymphatic drainage. So that's a little more theoretical at this point, but we pretty sure it happens. We know it happens. We just don't know how it gets there, I guess, yet. So there's more research that needs to be done on this, but there's quite a bit out there now. Journal of Neurology has a great article that gives us B-level research, which is very high for something this new, which is cool, which shows that these 1.3 to 1.5 atmosphere level chambers are the best for neurocognitive rehab in conditions like concussions and TBI and stuff like that.
So, I know a lot of us have heard about HBOT, and we're often told like you have to have like 40 dives to get proper results. What are you finding with the way that you're using HBOT in your clinic?
Yeah, that's a great question. Glad you brought that up. It is cumulative, and I do use the 40 as a baseline as well, because that's what a lot of the research shows. So with that, if to rebuild kind of the cytoarchitecture, we call it, from kind of the base up, really rebuild those cells, really rebuild those connections, it does take 40, sometimes 60, sometimes less for people. We find it does it faster when we combine it with the neurological rehab that we do here. So we have people that come in and do 10, 20 treatments and have tremendous results, because we're doing a combination of therapies. That is kind of how my practice works anyway. We do comprehensive care. We're working on the proprioceptive systems, the vestibular, the cortical, your autonomic systems, your visual motor systems, and all these different things that we're working on. Plus you bring in that oxygen piece now with the hyperbaric, and like you just get this system that responds a lot faster. But if you don't have that, hyperbaric itself is tremendous. It just might take a little longer than with when you combine them. But still, I am more comfortable doing longer treatment on that for people who have a substantial condition. Now, if you have something like that, you come in with a strained sprain, and you're like, I just really want to decrease inflammation, let this heal, and I want to use hyperbaric. It doesn't take 40.
Right.
I have a patient right now. We won't get into that, but anyway, yeah. So there is something to be said about that 40, and we typically try to treat people every day. So we do 5 times a week, and then we treat them for 40 to 60 treatments. Some research out of Israel just came out where they did 60 treatments for whatever reason. And I think it was 2.4 atmospheres, or maybe it was 2 atmospheres. I can't remember. But anyway, after 60 treatments, they noticed a tremendous reduction in telomere, an improvement in telomere length. I think it was 37% improvement, but don't quote me on that. Look at the research, but it was, I think it was 37%. So we're learning about this, right? We're saying like, geez, 60 is what did this for this, but what would we can kind of presume that 40 would do something too. We know it does. And geez, what if we're not at 2.4? What if we're at 2.2? Or what if we're at 1 point? And so we know these things work. We're just gaining more information on it. So the kind of the catch-all a bit, if you would, in clinically, from the clinical side of it, is like, the more you do, it's better. It's not going to be too much. And so it's, but you still, if you're using those higher level chambers, you do have to be careful about certain patients, because there is overactivation of the brain that can occur with some of those higher chambers. If you have seizures or something like that, you just have to be careful. Certain conditions, but generally speaking, they're very, very safe, especially at the levels that we use for neurocognitive stuff. They're very, very safe. So but 40 is the answer.
Let's talk about the levels for a moment, for anyone listening. So there's the hard chambers that can they go like to 20 or something?
No. Like 3 atmospheres.
3 atmospheres?
Yeah.
Or maybe
It could probably go deeper, but we don't use. Oh, you're thinking of PSI. Yeah.
That might be it.
Yeah.
And then you're using a soft-sided chamber, correct?
Yes.
Yeah. So just maybe explain the difference in that and what we're talking about. Because I know like the origination of HBOT, it's traditionally used in the medical world for like healing wounds and carbon monoxide poisoning, and then divers, right, who get bends from coming up too fast. So maybe talk a little bit more about the different chambers and the different atmospheres and what that means.
Sure. So the deeper the chamber, the more atmospheres, the greater the pressure, the more oxygen that will be driven into the plasma. So at 3 atmospheres, you can get up to about 1,200% increase in oxygen. At 3 atmospheres, at 1,200% oxygen, you don't need red blood cells anymore. So they use these for people at times in hospitals who have been insanguinated or lost all their blood. They put them in these chambers. They retain their function. Yeah, really cool. People who've had MIs to create anastomosis or like angiogenesis, of blood vessel formation. So that's another thing the chamber does that we didn't talk about, but it creates new blood vessel formation. Actually quite an important one. So you can kind of grow around these little blockages if there's like 60% or 80% blockage, or even in the brain. So we're starting to do more research on that, which is very interesting. So what they thought with research initially is that you had to do higher pressure to get the changes that you wanted. And what they were seeing was that with their early research that the they were using lower pressure chambers as like their control. Like that was like, okay, instead of using nothing, they used that control. But they were finding that they were getting just as the same results with that as they were with the higher pressure chambers. So they were like, well, it doesn't work then. And then someone else came in and said, well, no, wait a minute. It works. You're getting the physiological responses and your measure. Your control is not really a control. It's actually a therapeutic treatment. And so they started going more into that, and they realized, oh, wait a minute, the 1.3 atmosphere chambers are getting tremendous healing and actually doing better for neurocognitive stuff than the deeper chambers, because the deeper chambers may be, I'm just going to say theoretically, creating too much activity in some of these areas of the brain where they actually can't handle that. It's almost overstimulating, where the 1.3 to 1.5 and these lower pressures are just the right amount. Or maybe even more could be, fine too. And so they went through this, and there's still a little bit of argument, because there's still people, the hard chamber people are going to stand by that. Soft chamber people are going to say, well, here's what it is. But the research is the research, and the results are the results. And whether it's a soft chamber or hard chamber, it really matters not, because you can put somebody in a hard chamber and do 1.3 to 1.5 atmosphere training too, which a lot of people do depending on the condition. And that's where a doctor that I work with, who's a medical doctor, great doctor, who's an expert in the area, named Dr. Schur. He is someone that I consult with and train with, and he's out of California, and he has all kinds of results and clinical information and protocols with this that is all based on research. And we're just doing more research on this now, and some of it is anecdotal in the sense where we're doing our kind of our clinical trials on things that we're finding what works clinically with people, and it's safe, and we're seeing tremendous results, and we have the basis in research, but we're seeing it clinically, and we're kind of ahead of the game a little bit. And so unfortunately, I don't have a PET scan or SPECT imaging in my office, but if you have that, you would see these types of things. But what we can measure is all of these other things that we look at with eye movements and reflexogenic systems and brain activity and these different ways that they work. And we can actually see these tremendous changes with it. And plus, the people, just these symptoms that change. We see wounds that heal that haven't been healing for people, that there wasn't even the reason we put them in. I had one lady that we hadn't started with hyperbaric with her, and she had a pretty solid, I think she was having headaches, but I think she had a head injury is what it was. And she had neck pain and back pain, chronic stuff. And we'd been treating her and getting decent results. It wasn't like, weren't hitting it out of the park with it yet. It's just taking a lot of time. I was like, listen, I think you really need to do this hyperbaric chamber. And she said, okay. And within 4 or 5 treatments, her completely turned around. She was doing tremendously better. And she had recently fallen, and which I hadn't even really paid close attention to. Well, we paid attention to it, but she had this pretty substantial wound on her leg, and that healed like that. And that wouldn't heal very well with her because she was older. And so we see that all the time. So we actually use it for these wound closures and stuff a little bit too. But the same wound that's happening on that you can see is the same, is similar to these invisible wounds in your brain. And people think, and it doesn't work like this, Amy. It's not oxygen penetrating your skin. It's not like that. So it doesn't matter if the wound is external or internal, because it's actually all these mechanisms are the air you breathe in. They're internal physiological mechanisms. So her skin was actually healing from the inside out, just like your brain is, just like that hyperbaric works. So it heals from the inside out. It's not the outside in. And that's something
great visual analogy there. The wound, whether it's on the outside on your skin or in your brain.
That's right.
Analogy. Yeah. Well, this has been great information. Again, I don't think we've really talked about HBOT, and it's such a key modality in an integrative approach. So thank you so much for being here today and sharing this information. And everyone watching, all your information is below this video, but if they want to find you, your website is portcairo.com. They can find you on Instagram at portcairo. And if they want to reach out, if they have more questions, or if they want to see if this might be a good fit for them, they can go ahead and reach out and schedule a consultation with you, correct?
Sure. Yeah, we're super happy. We love to chat about it, and we're happy to help people in office or direct them to a closer office if that's possible. Yeah, I was excited to talk about this too, Amy, because it's not something that a lot of us are doing,
Mhm.
and it's just an area that I want to create access for more patients with brain injuries and other types of conditions, because I think it's going to be game changing for the field.
Yeah. Yeah. And just the few people I know who've gone through it have had tremendous results from HBOT. So thank you
Yeah.
for sharing. Thanks for watching. I hope you enjoyed today's video. Be sure to hit that subscribe button so you don't miss any videos in this series. Like this video and head to Amazon to purchase Concussion Discussions.